To combat the opioid epidemic, plastic surgeons are actively studying our own practices and outcomes to keep our patients safe and healthy. One such study comes to us from Johns Hopkins, where these researchers reviewed almost 25,000 women who had breast reduction. They found some interesting trends among the 13% of patients who continued opioid use long after their procedures. Women aged from 35 to 64 were up to 27% more likely to seek opioid refills than 18 to 35-year-olds. Women with a history of alcoholism or clinical depression were up to 43% more likely to abuse the opioids. The researchers also concluded that the amount of narcotics prescribed plays a huge role in predicting addiction. So, as you would expect, women who were prescribed a large amount of painkillers were up to 160% more likely to use opioids after their procedures. But surprisingly, women who received a small amount of painkillers were also more likely to seek extra refills, up to 35% higher odds. So what does this research tell us? It reinforces two key points. First, patients and surgeons need to be much more upfront about the heightened risk from age, depression, and prior substance abuse before these procedures. Second, moderate dosing of opioid painkillers after breast reduction or almost any other surgery is of utmost importance. So what do? Together, the patients and us can work to manage postoperative pain and simultaneously combat the opioid crisis. To learn more about all these and other new developments in all of plastic surgery and beyond, follow PRS Journal on social media and read the #1 journal in plastic surgery.